All right, so let's begin. First, I'd like to welcome our elected officials who are able to join us today. I see the Mayor, Diane Therrien, and County Warden Jones, and hopefully we'll have a few others join us once we get to that portion of our agenda. So let's take a moment and ground ourselves in this beautiful place that we call home. Peterborough Public Health respectfully acknowledges that we are located on the Treaty 20 and Michi-Sagic territory and in the traditional territory of the Michi-Sagic and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, I will now invite our board chair, Mayor Andy Mitchell, to please start us off with some opening remarks. Go ahead, Andy.
Thank you, Brittany. The battle against COVID-19 will continue to occur on 4 fronts over the next several weeks. Although public health will be leading the efforts, each of us will have a role to play in our success. First is the importance of adhering to basic public health guidelines, not assembling in groups, wearing a mask, keeping a physical distance of 2 meters, frequent hand washing, and staying home if we are ill. Peterborough has been doing a good job. Keep it up. Second is effective tracking and contact tracing so that outbreaks can be contained and the number of people affected limited. Working with public health officials when they contact us is important and will greatly assist the effort. Third is testing. If you are experiencing COVID-19 symptoms, stay home and none of us wants to be responsible for spreading COVID-19. Fourth is vaccine. As supplies arrive over the next few weeks, a concerted effort will be required, and its effectiveness in part depends on its widespread use. When your turn comes, please take the vaccine. You will be protecting not only yourself, but your family, friends, and community as well. The community has done well combating the pandemic over the past year. Together, we will overcome the challenges of COVID-19. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy. We are certainly looking forward to when things get back to some version of normal. So with a current update on COVID-19 statistics and our situation, I'll now invite Dr. Salvaterra to walk us through these next slides. Go ahead, Dr. Salvaterra.
Thank you very much, Brittany. So as of 4:30 p.m. yesterday, there were 35 active cases, 13 more than on Tuesday. We're continuing to follow a significant number of high-risk contacts, 237 compared to 2005 just 3 days ago. In total, we've reported 598 cases since the pandemic began. 554 of those have resolved, and the number of local deaths from COVID-19 remains at 9. So far, we are reporting 15 new cases this week. This bar will, if you look at the next slide in the monthly graphs, you'll see the breakdown of our new cases, and you can see that as we have surpassed the halfway mark in February, we've had a total of 53 cases reported to us this month. Certainly still not as low as we were anywhere in the first wave last year. Next slide, please. This chart shows the trend continuing in terms of local exposures. High-risk contacts continue to be the largest source of exposure by a considerable margin over other sources. I know some of you were interested to see how many close contacts turn into positive cases, and this chart shows that so far, nearly 75% of our cases are the result of exposures from close contacts. When we look at the age and sex of our cases, here we can see there are slightly more female than males, and this is consistent with the provincial breakdown. Also on this slide, we can see the bar graphs that show the age groups of our cases, and you can see that the 20 to 29-year-old age bracket continues to have the highest number at 184 cases so far. We've given you the provincial breakdown of cases by age group just below it, and you can see the same trend with those aged 20 to 29 years experiencing the highest number of reported cases. This population is one of the most likely to work in sectors without paid sick days and often are the most precariously employed. Next slide, please. While this graph indicates that there are 2 active outbreaks, I'm pleased to share that this morning we declared the outbreak at Peterborough Retirement Home over. So we now have 1 active outbreak, and that is at the Buckhorn Daycare and Nursery School. Presently, there are 12 cases among staff and attendees connected to this outbreak, and testing is still ongoing. I can confirm that the index case was not a variant of concern, but you can see how quickly outbreaks can develop even when variants of concern are not involved. Our next slide is a map of Ontario, which shows the current configuration according to the COVID-19 framework. And you can see which color zone has been assigned to each public health unit region. So picking up on that last slide, let me see this time. Oh, okay. I was having trouble turning on my camera, but I see it's behaving itself now. So I'd just like to reiterate that being in yellow does not mean a return to normal. And I am urging residents to stay at home as much as possible, to minimize the numbers of trips outside of home, and to stick to members of your own household if you do go out. The lifting of the stay-at-home order has included some new requirements that are now directed to all individuals, which means that everyone is accountable for these behaviors and can face a penalty if found to be non-compliant. Regulation 364 reminds us that we must all wear a mask or a face covering when we are in any indoor area. We must wear a mask also when we are participating in any event or gathering which is permitted and under the regulation, and any time that we are within 2 meters of another individual who is not part of our household. So that will apply to outdoors as well if distances can't be maintained. In addition, Regulation 364 reminds us that at any time that we are in a business or a facility that is open to the public, we must maintain 2 meters distance from every other person, unless that person is our caregiver or a member of our household. So effectively, this means that sharing a meal or a beverage can only take place with members of our household. We cannot meet a friend for lunch. We cannot arrange to have dinner out with another couple or with anyone outside our immediate household group, even if the banquet hall or the restaurant can set a table for 6. While there are limited exceptions for those who cannot wear a mask, I encourage those who cannot wear one to either use a face shield or to stay home and make use of online ordering and delivery services. Following these public health measures is the safest approach, especially as we want to prevent the spread of any variants of concern. I have some good news to share on the vaccination front, and that is that we are expecting both the Moderna and the Pfizer vaccines next week so that we can complete our second doses in long-term care home residents. We expect to be back in long-term care homes by February 25th. We will also expect to begin immunizing long-term care home staff and caregivers next week, as well as the highest priority healthcare workers. We're making headway in our preparations to immunize other priority groups in this phase 1, including the residents and staff of senior congregate settings such as retirement homes, adults in the community who are 80 years of age and over, Indigenous adults, and home care patients. And we hope to start these groups early in March as vaccine supply permits. We have some preliminary results to share following the multi-ministerial enforcement blitz that has been taking place this week. So here to share this with us is our Manager of Environmental Health, Julie Ingram. So Julie, take it away, please.
Great. Thank you very much, Dr. Salvatierra, and good afternoon, everybody. So as Dr. Salvatierra mentioned, we have had the multi-ministry enforcement campaign in our area this week. Inspections started on Wednesday, and they will continue through to Saturday. We have about 25 provincial offences officers who are conducting inspections in both the city and the county of Peterborough right now. After the first 2 full days of inspections, officers have visited about 100 businesses for COVID-19 compliance inspections. And overall, the compliance rate that we're seeing locally is about 50%, which is consistent with what has been seen across the province in other areas where this campaign has occurred. So far, the campaign and officers who are conducting inspections have issued 4 tickets under the Reopening Ontario Act, and they have also issued 22 formal warnings. The most common violations that are being seen are businesses not having COVID-19 safety plans and not following appropriate screening measures. That includes both passive screening, having signage posted for members of the public, as well as the active screening that's required to be done by a person responsible for a business or organization. That means that all staff and employees have to be screened before entering into the establishment to start their work shift. So businesses are urged to look at your COVID-19 safety plans and establish them, and also review your screening protocols right now. The campaign is continuing today and will continue on Saturday. Once the campaign is complete, we expect to have more results to be able to share with you. Thank you.
Okay, thank you very much, Julie and Dr. Salvatierra. And I would like to apologize for the quality of the feed today. It seems to not be as strong as previous briefings. In particular, I noticed it was cutting out quite a bit during Dr. Salvatierra's description of the current outbreak. So before we get to our comments and invite our local elected officials to share any remarks they may have, I thought I would just quickly review those key messages about the outbreak. The outbreak at Peterborough Retirement Home has been declared over. There's currently just one active outbreak in the community, and that is at the Buckhorn Daycare and Nursery School. The daycare is closed. Presently, there are 13 cases among staff and attendees connected to this outbreak, and testing is still ongoing. We can confirm that the index case was not a variant of concern, but you can see how quickly outbreaks can develop even when variants of concern are not at play. So I just want to make sure everyone had a chance to get that information. All right, so now I will invite our elected officials to share some remarks, and I believe I see some of our municipal reps, Mayor Therrien and County Warden Jones. I believe Mary Monsef has been able to join us, and also MPP Dave Piccini. So let's start with our municipal officials. I'll invite Mayor Therrien if she has any remarks to go ahead.
Hi, Brittany. Thank you very much. I'm happy to be here today. Not too much to add, aside from the fact that I know, things are ramping up. We're getting excited about the potential of vaccines, but again, as we've been saying, just still need to hold the line. We are, reopening, and our local businesses are very happy about that. They are taking health and safety above and beyond what they're required to do, and so we definitely need to support them. But again, if you're not feeling well, stay home. There are options for curbside, for delivery, all of those things these days. So we just need to continue to be vigilant and stay in this. That's it for me. Thank you.
Okay, great. Thank you so much, Mayor Therrien. Okay, let's hear from County Warden Jones. And if your camera is working, I'm happy to put you up, but otherwise, feel free to just share your remarks. Go ahead, Warden Jones.
Okay, thank you very much. I hope everyone can hear me. I haven't got a whole lot to say. Diane pretty much said it for us all. Just please don't let your guard down. We've all got to still be aware that we're not out of the woods yet, even though some things are open, but we've got to do our best to get that message across. So hold in there. Peterborough County is still alive and well, and we will get through this. And we all need to take time maybe and have a bit of a smile sometimes. So again, thank you to everyone out there for doing what you're doing. We're all in this together. Don't forget that. Thanks.
Thank you, Warden Jones. Okay, so would MPP Dave Piccini, if you've got any comments you'd like to share, please go ahead. And if your camera's working, I'm happy to put you up on the spotlight.
Yeah, thank you very much. I just enabled camera and microphone. Can you hear me?
Yes, I can hear you fine.
Okay, thanks very much. I just have a brief update from the province of Ontario today, just at a high level. First, I'll start by just thanking Dr. Salvatierra for her remarks and the work that our healthcare professionals are doing on the ground in administering the vaccine. Dr. Salvatierra has been a real leader and been very responsive on the nuances, and we've required obviously the flexibility piece with vaccine supply, and they've done a very admirable job in getting those vaccines out. And I'll give you a bit of a high level overview of where things are at with the province of Ontario to date. We have completed the target of providing that first dose of the vaccine to residents in long-term care. As you heard from Dr. Salvatierra, second doses will be nearing completion for the province of Ontario. Over 63,000 long-term care residents have received at least one dose. Over 34,000 retirement home residents have received at least one dose, with over 21,000 fully vaccinated, and of the 63,000 in long-term care, over 44,000 have been fully vaccinated. Operation Remote with Fly-in Indigenous communities have offered the first dose of the vaccine, and we're continuing to work for completion by end of April. The vaccine update, as we've heard, the Pfizer BioNTech vaccine will be received, and those shipments have already begun, and we have 6 doses per vial. So we're working closely in getting those out to the communities, and very excited to see those vaccines come in, and we'll continue to work closely with our federal government and counterparts there, and also with our municipal partners. The trays that we're expected to receive remains the same, but the number of doses from February 15th onwards have now changed. Those dose numbers reflect that each vial, as I said, contains 6 doses. So for February 15th, we're expected to receive 156,780 doses. February 22nd, 186,030 doses. And then into the first week of March 1st and 8th, 173,160 doses. We are expecting for the week of February 22nd, 47,400 doses of Moderna vaccine. On the phased prioritization, Dr. Salvatierra spoke to that, so I'll move on the capacity piece for mass immunization clinics. All 34 public health units have developed plans to operate one or more mass immunization clinics and have shared that with Public Health Ontario. We also have discussions on mobile vaccine teams for second doses, and we know those are going out to LTC, as you heard earlier. We're also in conversations about a vaccine booking system. We're developing an online booking system to support the next phase of vaccine rollout. A customer service desk will also be made available for those who are unable or comfortable with booking an appointment through the online tool. We also know that broadband continues to be a concern for a number in the province of Ontario, and again, through collaborative work with the federal government, also through the ICON program and others, we're addressing those broadband deficiencies as well. The scheduling software was successfully launched in pilot mode in January, and work is underway to incorporate the front-end service in the coming weeks. So more to come on that. And that's it for me. As always, value this opportunity to have a dialogue with other levels of government. And again, I just can't stress enough. Thank you to the frontline workers who are doing a remarkable job in getting vaccines in arms. And we look forward to the weeks ahead and the shipments that are coming into the province of Ontario. Thank you very much.
Thank you very much, MPP Piccini. Great to have the provincial update today. So we will now invite our federal member of parliament, Miriam Monsef, if she's able to join us, and I can put you up on screen, Miriam.
Thank you so much, Brittany. Hello, everybody. Bonjour, Anin. Salam alaikum. On a snowy day on Mississauga territory, happy Friday to you all, Dr. Salvatera and your entire team. And the board. I know you're tired, but we appreciate you and you're doing a great job. I'll focus my remarks on vaccines today. Vaccine rollout is stabilizing and accelerating. While this is good news, this is also the time to be extra careful and extra nice to the people on the front lines of the delivery of the vaccines. Many thanks again to the volunteers who've stepped up to make it happen. We're on track to meeting delivery timelines, and we're also going to see those timelines accelerating. There will be unforeseen and uncontrollable delays, like severe weather that we saw in the States that temporarily delayed a Pfizer shipment, but we are accelerating the delivery of the vaccines that we were not expecting until Q3 into Q2. That's more than 5 million doses are going to arrive a quarter earlier. This will be enough to vaccinate more than 14 million Canadians by the end of June, and that's nearly half of the entire adult population by the end of June. This week, we received more than 400,000 doses of the Pfizer vaccine, and we'll be receiving nearly 500,000 more doses of Pfizer each and every week until the end of March. Next week, we're also going to receive a Moderna shipment with 168,000 doses, and we're scheduled to receive 2 more shipments of Moderna before the end of March with about 650,000 doses each. These numbers are based exclusively on the shipments of the 2 approved vaccines. There are currently 3 more under review by Health Canada. And if and when these are given approval, the vaccination levels will only grow. Vaccine rollout is stabilizing. It's accelerating. And while this is good news, this is the time to be extra careful and continue to follow public health guidelines. We're getting there.
Wonderful. Wonderful. Thank you so much, MP Monsef. So pleased you could join us today. Okay, so now is our opportunity to hear from our media partners. I see about 7 reporters have been able to join us, which is wonderful. Sorry, just to correct a number I shared before that Dr. Salvatera noted in the chat box, there are 12 cases associated with the outbreak at the Buckhorn Daycare. Okay, let's start with Matt Latour from Oldies and Freak Radio. So if you have questions for Dr. Salvatera, please go right ahead, Matt.
Yeah, I got one question for Dr. Salvatera. If somebody's gotten a dose of the Moderna vaccine, can their second dose be of the Pfizer vaccine, or does it also have to be Moderna?
For now, it needs to be the same vaccine, Matt. There is a clinical trial currently underway that is looking at mixing and matching the various licensed vaccines to see whether they will work together. But right now, we don't have that data. And so we are sticking to the same vaccine for both doses.
Do you know how many vaccines of each provider are expected to be arriving next week?
Well, we're expecting about 1,100 Moderna vaccine doses because that's what we need to complete the long-term care home residents that we gave first dose to. And the Pfizer vaccine, I believe we're looking at close to 6,000 doses of the Pfizer.
Perfect. Thank you.
Great. Thank you very much, Matt. Okay, Paul Rellinger from Kawartha Now. If you've got some questions for Dr. Salvaterra, go right ahead.
I do, and thanks so much, Brittany and Dr. Salvaterra. I also have a question for Julie before I leave. I just wanted to get a comment from you. A lot of family healthcare providers and doctors, I'm sure, I don't know this to be truth, but I'm sure, are getting calls from patients about when do I get the vaccine or when's it, and I'm just wondering what communication, if any, you've had or put out to doctors as to what they can tell their patients.
Well, we do communicate as much as we can. We have a website on our web page on our website that's dedicated to the vaccine. We are getting highlights out following the meetings each week of our interagency planning team. So there's good information in that. In addition, we are currently running a hotline. We get lots of calls, but we have been planning with the city, for example, to increase our hotline or inquiry line potential so that we can, as we roll this out, so we anticipate we will be getting lots of calls so that we can handle that. The province is also planning a concierge or telephone service to support the pre-registration and the booking of appointments. So we expect that will also be available to us soon to support us. And we've had a couple of meetings. We had a meeting last week with the township CAOs, and last night we had a meeting with the mayors asking that they help as well, because as well as family doctors, our municipal staff and leaders also get calls from their residents. And I know how eager people are to receive the vaccine. So we're going to use everyone we have out there to help get that message out and to answer questions as best as possible.
And thank you. That's all great information. But just to be clear, has your office communicated directly with doctors in any way to let them know this is what we're looking at so they can tell their patients?
Well, the way it works, Paul, is that we have a primary care lead on the interagency planning team, and it's up to that and so besides the highlights that we send out to doctors and others that are written, the primary care lead is also communicating with doctors and attends meetings. So for example, she's already had conversations with family doctors to find out whether we can use their electronic medical records to identify the over 80s. And we've had some conversations about potentially using family doctors' offices to call, because none of them have email addresses. So that is happening.
Okay, thank you. And thank you for clarifying that. Sorry to be a bother on that.
That's okay.
I also wanted to check not a clarification, I guess it wasn't mentioned, but the index case at the daycare, do we know if that was a staff person, a child, or a visitor?
I don't know that. I'm sorry, I don't have that information. All I know is that we did have it checked, and that it's not a variant of concern. That's the only information I have.
Okay, and then that leads right into my next question, and touching wood here that we don't have a variant of concern in our area. We really are an island in a sea of variants, it seems right now. They seem to be around. Up in Muskoka was pretty heavy. Toronto certainly has a number. Is it, I mean, all these best practices that are in place are good things, but in the back of your mind, is it like waiting for a shoe to drop?
I think that it's very likely that we are not going to be able to contain the variant, and that's because although the public health measures are effective, what other jurisdictions have seen is that where mobility continues, where people are moving around, whether it's to the store or whether it's driving to other places in the province, when that happens, there will be spread of the variant. So unfortunately, unless we had much more restrictions on travel, I expect that we will see the variant spread. I think what we're trying to do is contain it as best as we can and to slow it down.
Okay, thank you so much, Dr. Salvatore. And if I could, for Julie, you mentioned that 4 tickets and 22 formal warnings have been issued, I believe, since Wednesday by these 25 offenses officers who are in the area. I guess I have 2 questions. First of all, we're almost a year into the pandemic and people are still getting warnings, and I'm trying to wrap my head around that because these things have been well in place for quite a while. So if you could comment on that. And also, I think you said a 50% compliance rate, and I'm just trying to understand what that means. Does that mean 50% of the businesses that were visited were either warned or ticketed?
Sure. Yeah, I can clarify both of those points. So first, I'll speak to your question about a warning. To make it clear, a warning is an enforcement tool. It's one of the tools we have in our box. Education is an enforcement tool. Warning is the next step, and then we go to a charge. So you're right in that we have been in this for almost a year now, and many of these things have been in place for quite some time. But I will provide the context that the regulations are very fluid. They are updated on a regular basis. They have new additions and slight changes to existing requirements. So for instance, when it comes to active screening, only recently has it changed that screening must be done prior to a staff member or an employee entering an establishment. So previously, some businesses may have had staff come in and then they do the screening in the staff room or something like that. So that would be a warning situation. It's a recent change and we need to provide the warning because this is a new thing for businesses. So it wouldn't warrant a charge. What would warrant a charge is if a premises had no procedure for screening of their staff and employees. That would then escalate to a charge. So there is a place for warnings, and it is an important tool that we do still have to continue to use. So I hope that clarifies that piece. Yep. Great, thanks. And so on to the other piece, which was the 50% compliance rate. What that means is that 50% of businesses are essentially fully compliant. There were no violations issued. There were no, or not issued, but identified. They're doing everything they can to the very best of their ability. The other 50%, so the other half of businesses, have something that they can improve on. So maybe that's something to do with physical distancing. Maybe it's a flaw in their safety plan or a little piece of their safety plan that needs to be updated. Maybe it's something more serious that they don't have a safety plan altogether. But any little thing would put that premises into non-compliance and contribute towards the half of the premises that are not compliant.
Terrific. And if I could just, is it a safe assumption that if a business was warned, for example, on Wednesday of this week, and they're revisited in a couple of weeks, and the situation that they were warned about is still an issue, they would be ticketed at that point?
Yeah, that's correct. And that's what we consider to be progressive enforcement, which is one of the things that we really strive for. So it's that education, warning, and then a charge. So absolutely, if a premises has been warned in the past about something and they get a reinspection and they're not compliant, yes, most likely they will receive a charge.
So I'm sorry to go on this point. So the businesses that were warned this week weren't necessarily warned the last time around. Or
Oh,
they
that
just,
that
or they
would
just been
be
ticketed?
correct. Yeah, not necessarily. They may have been warned in the past, but I wouldn't know that, and I won't know that until I start looking at the list that I get back from the campaign. But it's possible they could have been warned in the past, but unlikely. If they've received a previous warning and they're still not compliant on that same issue, it would escalate to a charge.
Okay, terrific, Julie. Thank you so much, and thank you, Brittany.
Okay, great. Thanks so much, Paul. I see MPP Pacini has his hand up. Did you have something you wanted to add to this? Please go ahead if so.
Yeah, thanks. I do. If I may, just add one quick update, just on the with respect to the emergence of the variant. I just for the benefit of the reporters wondering about the variant, Ontario did launch a 6-point plan on response to the variant, which arrived, of course, internationally. But that includes mandatory testing of travelers, enhanced screening and sequencing, maintaining public health measures, strengthening case and contact management. Protections for vulnerable populations, which I alluded to earlier. And just a key point is on the data piece. A made in Ontario technology company, DNA Stack, is establishing genomics data bank and real-time analytics dashboard to really empower provinces' PHUs and improve on our planning related to the pandemic response. So I'll include the link for more on that, just for those that might want to include that relative to their questions on the variants. That's it. Thank you.
Great. Thank you very much. Excellent. Okay, so I will now invite another one of our reporters. How about Taylor from Peterborough This Week in my Kawartha? If you've got some questions for Dr. Salvatierra, please go right ahead.
Thank you, Brittany. Actually, my first question is for Julie, if you don't mind. Julie, of the 4 businesses that were ticketed, do you know what violations led to those tickets?
I do. I am being kept in the loop for the most part by the leads of the campaign. Without getting into too many specifics, the overarching themes are regarding safety plans and screening. Those are the most common violations. However, I know that there have been violations with respect to masking too.
Okay. Just in regards to when we published the last there was a ticket for another business the other week. We got a lot of comments from people saying, you know, why isn't the public being kept in the know as to who these businesses are? We should be allowed to know who these businesses are so we know what businesses we should be patroning. I'm just wondering if you wanted to address that.
Yeah, I can touch on that. And, you know, while I appreciate the curiosity and the desire to know the establishments that have been charged, we have to understand that there really is a difference between wanting to know and needing to know. If there was a risk to the public, if there was something serious and the public's health was at risk, we would disclose the information. We have done that in the past, and we would continue to do that, but only if there's a risk to the public. If a business has been charged for non-compliance under the Reopening Ontario Act, but there is no risk to the public, then that's not something that we are going to disclose. And I know that the provincial campaign is not disclosing specific businesses either. I just want the public to feel assured that even if a business has been charged, it doesn't necessarily mean that it's unsafe for them to go. It just means that they're not doing, that business is not necessarily filling their obligation under the legislation to put the measures in place to ensure ongoing safety and to make sure that they are doing everything that they can as a business operator to protect the public. So rest assured that if there was a risk, we would disclose that information.
Okay. Thank you so much, Julie, for that. I appreciate you letting me know that. I'm going to move over to Dr. Salvatierra now, if that's all right. Just in terms of, I'm just wondering, you know, I think, you know, we've heard some statements from you. We've heard a few statements from Andy Mitchell, you know, talking about how just because we're in the yellow zone, that it's not an excuse to go out and kind of pretend COVID doesn't exist anymore. Are we seeing that? Are the close contact tracers seeing people who are kind of taking the inch that they've been given and treating it like a mile?
Well, you'll have to remember, Taylor, that the cases that we are identifying this week had their exposures while the stay-at-home order was in play. So there's a bit of a delay between exposure and then incubation, getting symptoms, and then being identified. So I think what we're seeing this week are still from exposures that occurred while people were still staying at home. Going forward, it'll be interesting to see now with the lifting of the stay-at-home order by next week. We should get a better sense as to what's happening post the stay-at-home order.
Okay. I feel I might be asking a little bit to tread familiar territory, but there are still a lot of people that are asking questions about vaccine rollout here. Just in terms of, when we do start to see vaccine rollout in terms of, moving past long-term care and retirement homes towards the more general public, what exactly is that going to look like? I know we've talked about clinics. Do we have locations nailed down for that yet?
We almost there. We're just, we're that close. We certainly know where our preferred sites are. We just need to formalize those with the municipalities. But I can speak in broad terms. We know that PRHC will continue to have a clinic on site there, and that's where we will be sending our long-term care staff, the retirement home staff, the caregivers, the healthcare workers will all go to PRHC to get their immunization there. In addition, we will be opening up another mass immunization site here in the city, and we are looking at 4 sites in the townships, which will rotate. So we'll have lots of opportunity and places for people to be immunized. The way it's supposed to work, Taylor, is that people need to pre-register. So for people who have internet, it will be an online pre-registration process. It's also the way that we can filter out people who are at higher risk, who need to be immunized in the hospital rather than in a clinic. So we'll go through contraindications and risks for the vaccine. So it's also a consent process. And once people are registered, they then get a notification. So they have to put either an email address or an SMS address, and then they are notified when they become eligible for the vaccine. And that's when they are able to book an appointment. We understand that many of our older adults do not use internet, and that internet's an issue for many of our rural community. So that's what the province, they've promised to provide us with a telephone concierge service, and we will supplement that with our own hotline, inquiry lines here within Peterborough. So hopefully people will be assisted to pre-register online, by phone if they need to, and then will be notified or provided with an appointment at that time. So that's how it's supposed to work. And we have been, we've been given certainly assurances that this will be up and running for us in March. So we're hoping it'll be soon enough that we can use it for the first group of community residents, which will be the over 80s. We will hope to complete the 80 and over group in March.
I'm very much looking forward to seeing all that happen and starting to see the vaccines end up in our seniors in the community. Just a final question, just one clarification. You said that we're expecting 1,100 doses of the Moderna and 6,000, sorry, was it 6,000 doses of the Pfizer?
Close to 6,000.
And that's next week we're expected to get all that?
Yes, we are.
Okay, perfect. So total of 7,000 doses then we'll get next week. That's perfect. All right. That's everything for me. Thank you.
Okay.
Great. Thank you very much, Taylor. Okay, I see Danelda Fraser is joining us from the Havelock Rail. Danelda, did you have any questions for Dr. Salvaterra today?
No questions today. Thank you.
Okay, great. Glad you could join us. Okay, let's move on to global. And I see Mark Junta is filling in for Jessica today. So Mark, if you've got some questions, please go right ahead.
Yes, good afternoon. Just one question really, and it's just about that outbreak in Buckhorn. I was having some audio issues. I didn't hear everything, so you may have already touched on it, but just could you break down, is there any child cases, staff cases, that sort of thing?
Yes, I can break that down, Mark. So there are 12 cases to date. We had 10 cases yesterday, 2 today, and of that 12, 6 are in staff and 6 are in daycare attendees.
Okay, perfect. Thank you so much.
You're welcome.
Okay, so let's invite Joelle Kovac from the Examiner. If you've got some questions for Dr. Salvaterra, go right ahead.
Okay, yeah, I have 2. What about Buckhorn? I imagine you're now following their families. Is that the case? Because their families would be close by.
Yes. Yes, so we have identified all of the high-risk contacts, which would include their household contacts, and they're all being followed as well.
Okay, that's really helpful. The other question was about vaccines. If you are beginning the 80+ groups in March, will they get 2 doses in March, do you think? Or is that 1? Or what, when you say you mean?
Well, it'll depend, of course, on which vaccine we use. I'm anticipating that we'll be using the Pfizer, which needs to be given 3 weeks apart. So potentially, Joelle, if we might be able to get them all finished in March.
Okay. And does that mean if you're starting in early March, then are you expecting further shipments beyond the next one? I guess that would be one following, right?
Yes, so we have been, we've been advised that we should expect weekly shipments of the Pfizer. With the Moderna, it's monthly, but so definitely with the Pfizer, it should be weekly. We don't have that information yet, but the province has assured us that we should get a 4-week sightline on our vaccine. So we should be able to see what's coming in up to 4 weeks away. And that will allow us to manage the supply, because we have to hold back enough doses to ensure that, especially with these older residents, we need to be on time. We can't extend the interval for them. So they need to have their second dose 21 days later. And so we will need to make sure that we account for that in our planning.
Okay, that helps a lot. Thanks. I'm done.
Okay.
Great. Thank you, Joelle. So Reg Watson from the Examiner, did you have any additional questions?
No, thank you.
Okay, great. Okay, well, then I think that brings us to an end. And as I noted through an advisory earlier this week, we are resuming weekly media briefings that will happen on Thursdays at 12 noon. So if you would like me to send you the meeting invitation so you have that in your calendar for next Thursday, please just pop me an email. Thank you so much again for joining us, and we will see you back here next Thursday at noon. Okay, have a great weekend, everyone. Thank you.
Thank you. Thank you.